Hello, let's talk about restoring dark teeth. Many of these dark teeth are tetracycline stained teeth. Tetracycline is an antibiotic that was given to children or to parents back in the day. Most of these people with tetracycline stained teeth are in their 50s or 60s because it was a great medication for ear infections, a great antibiotic for ear infections. What they didn't know for about 7 years when the permanent teeth came in was they turned the teeth brown or blue. So we see a number of patients with either mild to moderate to severe tetracycline stain in that age of 50s and 60s. So this woman had had her teeth bonded with bonded composite. You can see how bonding doesn't last that long and it absorbs light. It doesn't reflect and refract light like veneers. It also stains and pulls away from the teeth. So she'd had her upper teeth bonded. In this case, you can see the dark shade of the teeth. So in this case, we're only veneering the upper anterior teeth in this phase and doing some bonding and bleaching on the lower anterior teeth. Now, bleaching is not going to affect tetracycline stain or intrinsic stain a whole lot. It's going to bleach them a little bit, but if the stain is deep within the tooth, the bleach can't get to it. So it's not going to have a dramatic effect on it, just a slight effect. So these are veneers on her upper anterior teeth. This before and after. You can see how the veneers reflect and refract light like natural teeth, whereas the bonded composite absorbs the light. So I've done some bonding down here, and you can see the bleaching doesn't affect the teeth that much, which we bleach the lower teeth. But when you smile, you really don't see the lower anterior teeth that much. So if finances are an issue, you go ahead and do the upper teeth, and you want to go back to the bicuspids. You want all the teeth that show when the patient smiles to be veneered if you're changing the shade. It looks awful if you've got teeth displayed that are not veneered if they're darker. Is this before and after? Before and after. See how dark those teeth were from we went back to the bicuspids on each side. Sometimes you'll go back to the molar. The incisal plane, you can see when she smiles, you really don't see the lower teeth that much. So if I'm veneering maxillary teeth and I'm changing the shade, I pay zero attention to the lower anterior teeth. I pay zero attention to the shade of the lower anterior teeth. Why? Mainly because you don't see them like you see the upper end. More often than not, if patients don't veneer the mandibular teeth at the same time they're veneering the maxillary anterior teeth, they'll come back at some point and veneer the mandibular anterior teeth. As a matter of fact, I'm veneering the mandibular anterior and bicuspid teeth on a woman next Wednesday that we had veneered her maxillary anterior teeth and bicuspids a year or two ago, and now she's coming back and having the mandibular teeth. But you can see, you really don't see the lower teeth, so don't ever pay attention to the shade of the mandibular teeth if you're not veneering them. Idealize the shade of the maxillary anterior teeth, but be sure to go back to the most posterior tooth that shows when the patient smiles. Another woman that has tetracycline stain, and someone had placed bonded composite on these maxillary anterior teeth, trying to help it, but you're just not going to get anywhere with large bonded composites because they stain, they leak. Anything that stains carpet, white carpet will stain bonded composite. They chip, and the big thing is they absorb light. Composite absorbs light. It doesn't reflect and refract it like a veneer. So you can see the tetracycline stain on the mandibular teeth. So this is before and after. So we've veneered the upper and lower anterior teeth and done some restorations on posterior teeth too that had some old crowns and leaky restorations. It was before and after. Another tetracycline stained case. Again, this woman is in that age range of 50s and 60s, and you can see the dark stain of the teeth. Had some chipping, had a bunch of old leaky restorations on her posterior teeth. So that's why you want to do a comprehensive exam before you do anything. I want to know what we're getting into. I tell patients I'm a home remodeler, and I want to know what's happening with the house before I fix the kitchen. So before we veneer these front teeth, I want to know what's going on with the old restorations. You can see some decay here. And what does the patient have in mind? How good do they want it? Because a lot of times people have just not talked to patients about restoring the teeth ideally. An example I use is if you were driving a car to California or Alaska, what part of the car would you want to work? All of it, if you're driving to Alaska or California. So give the patient a chance to do the work optimally. See, she just had big old bridges, leaky, had a root canal through that one. So I wax it up ahead of time, and this is before and after. So veneering the anterior, upper and lower anterior teeth, replacing those old crowns, leaky bridges with modern crowns. See the darkness of the teeth. We've got to replace this bridge, replace these crowns, and a cracked tooth here. Replaced a crown on that, just a bonded composite on those. Sizal plane, her teeth were a little short. You always want some tooth display with the lips in repose. When the patient just lets their lip hang and says, you want to see some tooth. Otherwise, it looks like the patient has no teeth. You can watch my video on fundamentals of aesthetics. So I want some tooth display. This woman had also had some bonded composites placed on her maxillary anterior teeth, had some spaces. The dentist was trying to do a good deed for the patient at the time. I think finances were an issue, but you can see how they've decayed and leaked and stained and how they don't reflect and refract light. They absorb the light, they chip, so she just really didn't like her smile. And I don't ever try to talk a patient into anything. I just say, how good do you want this? And I show them cases like theirs we've restored, and that's most of the consultation, just to show a patient what can be done. So just had all that bonding on the teeth. So this is her before and after. This woman had some moderate tetracycline stain. Not terrible, just moderate. And again, they're all going to be in that age range of 50s and 60s. It's intrinsic stain, so it's not going to bleach. You might get a little bleaching, but not much, because that stain is on the inner part of the tooth, in the dentin of the tooth. This is before and after, veneered the upper and lower anterior teeth. This guy just had some hard-working guy, had some crowded teeth, worn teeth, tetracycline stained teeth, and he said, it's time I did something about my teeth. He didn't want to go through orthodontics, and I don't automatically restore teeth without orthodontics. I wax it up ahead of time and see if we can correct it with veneers without too dramatic restorative process. So see, he had some crowding upper and lower. Teeth were a good length. You decide what's going to be the go-to tooth. They were about the right width and length. So I wax it up ahead of time, upper teeth and lower teeth. Read the article in dentistrymasterclasses.com library on how to wax up a case for veneers. This is on the stone model. So if I can wax it up, I know I can do it in the mouth. I like this better than computer imaging. So this is the wax up. This is him before and after. He had a low lip line, so the discrepancy in the length of these teeth was not an issue because that didn't show when he smiled, but you can see the lightening of the teeth, how dark tetracycline stained teeth were. This woman just had some teeth with all kinds of issues and just didn't like her smile. If I'd been her, I wouldn't have liked it either. So discrepancies in shapes of teeth, tetracycline stain. She had a cacophony of issues. Crowded teeth down here. Wax it up ahead of time so we know what it's going to look like when we get to the end. And if we can do it without orthodontics, so I could do this without orthodontics, that's the wax up. Here she is before and after. So I didn't do any crown lengthening on her like that other video. We were able to fix this just by changing the lengths of some of the teeth. I just saw this lady in hygiene the other day. I did this probably 10, 15 years ago maybe. So you can see before and after. Had some old crowns on some posterior teeth. Those are okay. Tetracycline stain. That's the dental minute. These techniques work, and they work every time.
Are you feeling stuck? You know you have more to offer and you can elevate higher in your dentistry practice, but you just don't know how to do it? Well, great news. DentistryMasterclasses.com is here for you. At DentistryMasterclasses.com, Dr. Cutbirth is offering his greatest work and his best cases. Here's everything included when you subscribe to DentistryMasterclasses.com. You will get incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and the Dentistry Masterclasses, comprehensive cases for study and reference. You will get before and after pictures of Dr. Cutbirth's fantastic restored cases. And guess what? All of this is $40 a month. That's right, $40 a month. This is an opportunity you cannot miss. Go to dentistrymasterclasses.com and subscribe today.